Hi, I'm Solène Tircuir, sociologist, global health expert, and immigrant storyteller.
And I'm Sacha Ledon, entrepreneur, startup advisor, and lifelong connector of founders from every corner of the globe.
Welcome to Beyond Borders, a podcast about what it really means to build a life, a career, or a dream far from home.
Each week, we speak with people who've crossed countries and cultures, sharing the challenges, the breakthroughs, and the unexpected moments in between. That's where the real story begins. Welcome to Beyond Borders.
Today, we have the privilege of welcoming someone whose life embodies purpose, resilience, and global impact. Professor Julieta Gabiola. Born and raised in the Philippines and now a clinical professor of medicine at Stanford, Julieta bridges worlds clinically, culturally, humanly, and her work in internal medicine, education, and health equity reflects a career built on compassion and a deep sense of responsibility to communities often left behind. Beyond her clinical work, Julieta is a beloved educator, mentor, and author. Her interdisciplinary textbook has shaped the training of countless students, and her advocacy for women's leadership continues to open doors for the next generation. It is an honor to have you with us. Welcome to Beyond Borders.
Thank you, Colin. How are you? So it's such a great opportunity to be here today.
We're so happy to have you here. I'm doing great. I hope you're doing good as well.
Today, I am so excited to be with you.
Well, awesome. So let's start from the beginning. So you began your career as a nurse in a large Filipino family before becoming a physician in the US. Can you share how your journey started?
So actually, my journey really began in high school in Pampanga. I had a chemistry teacher at the time, Miss Fisher, a Peace Corps volunteer, who opened my eyes to the exciting realm of science. Around the same time, my mother was often in and out of the hospital, and my uncle, who is a veteran, taught me how to give her injections for her TB. I didn't fully understand her illness or why my brother, who had Down syndrome, was so fragile, but it stirred something in me. I wanted to become a doctor. But poverty was a reality to overcome. My parents could not afford medical school, so I convinced them to send me to nursing school, and I promised them that they will only pay the first semester of college. And at that time, I thought about nursing school as a pathway to go abroad and help support my family. Looking back now, nursing gave me the foundation I didn't know I needed. It taught me humility, empathy, and the art of care. Those early lessons shaped the teacher and humanitarian I became.
Seems like you have these big dreams and goals in mind. Can you elaborate a little more on why that mattered so much to you and how this has become such a driving force for you and to be sure that you will move forward?
Yeah. So I knew there was only two choices. Either I will grow up not going to school or trying everything I can to be able to go to college. And we were so poor, I was denied in the family. And I saw my brothers and sisters having to stop school because there was not enough money for tuition. So I thought I'm going to go to a big school where I can compete for scholarship. And if I get a scholarship, I would try my best to keep that scholarship to finish. And so I promised them, not knowing that I could actually accomplish that. So I went to college. They paid for the first semester, and I was able to compete. And I was given scholarship every semester until I finished 5 years of nursing.
And what's the idea of coming to the US to go to medical school early on or thinking about when starting the nursing school?
Yeah, so in elementary grade in Pampanga, we lived about 30 minutes to Clarkson Base. Growing up in the Philippines, we inherited a colonial mentality. Anything Western felt superior. I remember going to Clark Air Base as a girl and feeling that everyone with fair skin, blonde hair, and blue eyes were so beautiful. They were somehow gods, and I felt we were less. I used to think my English wasn't good enough, my skin was too dark, and my nose was too flat. So, yes, I dreamed not only to becoming a doctor, but being in America. And then I guess when I finally came over to the US, everything I believe about worth and identity began to shift. I realized success isn't about how you look or where you live, but it's about purpose and your heart. Now I see my dual identity, Filipino and American, as a gift. It allows me to move between worlds, to connect, and to remind others that you don't need to erase who you are to belong. You just need to embrace it.
Is it something that is part of the initiative that builds ABC for global health as well? What you just mentioned?
Yes, because I think becoming a doctor, and when my kids went to college, I found a new purpose. In becoming a doctor, I felt that I could share that, and it brought the very responsibility and advocacy of becoming a doctor. So when I lost my husband to pancreatic cancer at 42, life came to a full stop. As you know, he was a psychiatrist and a neuroscientist, very brilliant and kind. My children were just 8 and 9 at the time when he passed away. But then when my kids went to college, it gave me courage to continue on and to develop a new, and that is bringing care to those who had none. So that led me back to going to the Philippines for medical missions. And each trip, I saw the same people waiting year after year for care who should have been having an ongoing care. So when I create ABCs for global health, it's not just to give care, but to sustain it.
You're now US citizen while you keep maintaining relationship with the Philippines, and that gives you such a unique lens. How your dual identity, both culturally and professionally, influenced your work in both countries.
Well, it is nice to live in two worlds, right? So it gave me both the perspective of being two worlds and to connect and to build bridges. Not just build bridges between countries, but also build interface between science and humanity. So that's an advantage for me. What I learned in the US brings it back to my home country, and what I learn from my country, it brings it to the US and how I practice medicine in the US. So in fact, bridges between both countries, the compassion is the same, leadership is the same, and it keeps maintaining a sense of balance for me. So I came here as a nurse. We had two batches of 90 nurses. So the first wave was 45 of us coming to the US. And that was my first time to be in an airplane. And we didn't know how to use any of the tables and the airplane. And I kept looking at the next passenger and see what they were doing. And then when we landed in the US, in New York, we were shuttled in a bus. And the way to um, Philadelphia, I saw graffitis and boarded buildings. And I thought we were going to the wrong place because what I have a picture on a postcard are those white houses with snow around them with white picket fences. And what I saw were graffitis, buildings that were run down. So I thought they were taking us to the wrong place. So that was a shock. And there were so many, many funny stories that I could share. But at that time, when I was in the US the first time, they were anxiety provoking. Like I was in the ICU, I was making the bed, and I asked the patient to turn over so I could change his sheets. But my accent at that time, I could not pronounce sheets. It came out as shit. So, of course, in the Philippines, we don't have long E. So the patient started screaming, and I didn't understand. I was mortified. I was just helping him. And I understood that he got it wrong. And so from that day on, I said bed linens. And then one time, I went to a grocery store and I was so excited because I saw these canned foods that were so cheap. So I bought two big boxes to send it to my family, only to find out that they were cat food. So uh, it was really tough. My English was so bad that not only that I could not articulate in English, but I could not even take phone orders from the doctors. I felt that they spoke too fast, that by the time I was ready to write down the verbal orders, they already had hung up. The food was also a challenge. I could not survive on those hamburgers. I missed rice and adobo terribly. But then living with Filipino nurses in a retirement complex gave us community. The elderly residents there called us their little angels. That kindness reminded me that laughter and empathy truly bridge cultures.
And after this experience in this nursing home, what led you to apply for medical schools in the US? And usually when we talk about the education system in the US, we think it's very hard to get in because it's so expensive. And you coming from the Philippines, from a poor family, how did you end up attending medical schools in the US that really built the rest of your career afterwards?
Yeah, so it was a dream of mine to become a doctor. Actually, nursing was a stepping stone for me. Built the path for me to think about medical school. And I knew if I went to the United States, I would somehow become a doctor. So that was a dream of mine. So, the first year of nursing, while I was working, I was already researching the path to med school. So from Philadelphia, when I moved to Chicago, I worked for Rush University, and they had a medical school, and they also had a nursing school. So I built connection at what the possibilities and requirements for pre-med. And then I started going to do my pre-medical school in Chicago. And then I applied to medical school. And I was very fortunate to get in the first time. And I went to Rush University, and then that paved the way to go to Stanford for my training.
Wow, that is so, so impressive. And I'd like to go back to ABC for global health, given what you highlighted in terms of values and purpose. With this mindset, you launch so many initiatives, and one of them is medical mobile clinics. What inspired these innovations and what lessons have you learned about delivering healthcare outside traditional systems?
So as I mentioned, when my kids went to college, I found a new purpose to be able to give back to the Philippines. And I started joining medical missions to go back and to relearn what are the gaps in healthcare in the Philippines. And what I found on the medical missions, those short-term medical missions where there are about hundreds of us, like nurses, doctors, educators, and students who go to the Philippines, and we will see like about 1,000 patients per day. And we will stay there for 5 days. And it's so fulfilling because In such a short time, we could see a lot of patients. But then when I reflected back, I felt that short-term medical missions were simply band-aid to chronic disease management. I was interested in hypertension and diabetes, and if you don't have outcome data or you don't know what happened to those people you gave 1 month or 2 months prescription, then I felt that I was not achieving anything. So I proposed that we will stay in one community for a long time until we build capacity and until we change their outcomes. But the Philippine Medical Society of Northern California was not open to that suggestion. So I created ABCs for Global Health. And the four platforms on ABCs are to not only treat acute and chronic diseases, but to also integrate much needed prevention, education, and research so we could study what outcomes we need to achieve. So we created this medical mobile clinics that went to the community. We started one community at a time. And now we have 18 communities that we follow. And we also expanded to integrate telemedicine using Dr. Graham with multiple devices that are Bluetooth enabled to monitor patients remotely. And we launched that program 2 years before the pandemic. So we were already doing telemedicine using remote monitoring devices way before the pandemic. And I thought that is a proof that innovation doesn't have to start in high-tech lab. It starts with, again, empathy, with heart, and with listening.
You also mentor students, and from high school to medical school, and through global health immersion programs in the Philippines. Can you elaborate a little on that as well?
Yeah, so what I learned from the medical missions, the students were so much part of the community, and I realized that we need students to be with us, not just doctors and nurses. So in 2016, I was approached by a high school student from Cupertino who asked that if he could volunteer in our medical missions. My first reaction was like, oh my gosh, you're too young. What could he possibly contribute, right? But then I allowed him to join us. And what that I found out from that experience is that he changed my mind completely. His energy, his curiosity lit up my team. He asked questions that no one else did, and he connected with my staff and my patients so well. That's when I realized leadership and compassion are not defined by age or by degrees. They're defined by authenticity, willing to and their hearts. Since then, I've opened our programs to learners from high school to public health master degree program and medical schools. And in our clinics, you'll see a Stanford student teaching a teenager on how to take blood pressure, and you'll see Filipino doctors mentoring an American. It's cross generational, it's very collaborative, and it's very humbling. The core values I hope that they will carry forward are empathy, humility, and inclusivity. The courage to lead with heart, serve with integrity, and see people, not problems.
How having a clear sense of purpose has guided your decisions, and from moving across continents to launching your global health programs. How would you describe the role of purpose in your life and work?
I think going through life and the adversity I experienced, it created not only resilience, but a sense of purpose. Every adversity I have encountered set me to a path of purpose. So, for example, resilience. because life, as I mentioned, had tested me many, many times. Growing up, for example, in extreme poverty and losing my husband, raising children alone, and adapting to new worlds. So I think resilience taught me that it isn't just endurance, but it's finding grace in meeting those hardships. So I developed a sense of purpose that is guided by meaning and not metrics. And I tried to build bridges between two worlds, like Philippines and the US that I mentioned, and then between science and humanity. So I think throughout my life, when I experience something, it gives me a new purpose and it creates new meaning. And that happens almost every day that I find meaning in whatever I do.
Is it something that you're trying to instill in your students' mind or help students and colleagues clarify their own sense of purpose? I'm asking that because, sometimes you have big dreams and goals, and you may see challenges and trials and sometimes things not going the way you want it as failure.
Yes, when I teach, I try to listen a lot and observe a lot. And I let students make mistakes and find their purpose. Sometimes I think unknowingly with role modeling, sometimes we share part of us that's unconscious. And I think that's how I lead, that's how I teach, and that's also how I learn. Each trip, for example, to the Philippines bring me a wave of students who are very different from each other. And I let them feel, assimilate, and listen to each other. I let them learn from the community. And I always say, let the community or the patients be your book. So that's bringing real world experience to them, that it's not a classroom experience. And I think the real world creates their meaning, their purpose, and but it's something that they should find within themselves. So I have students, for example, who go to the Philippines who would like to just get a letter from me, or they want to build up their resume so they could apply to a good college or to a good medical school. But then when they go to the Philippines, they find something else. They find themselves. They find their own voice. They develop a new identity. And it's funny because parents would even comment, what happened to my kid? My kid now communicates better. They know how to listen and they feel that they have now a purpose. And before they went to the Philippines, they didn't see that on their kids. So I think it's that keeps me doing this over and over again, because even for me, I learned a lot from them as much as they learned from me. And, when I came to the US, I felt less, right? I felt I need to change, but I don't know what that change would look like. And I think through my own, meeting adversities, I learned more about myself and my own identity. And I'm so comfortable of who I am. I don't have to be that person that I thought that other people want me to be. So I found my own voice and I found my own identity and my own purpose. And I think it's that I want to impart to other people when I take them to the communities or even when I teach in the classroom. And that's the same thing that I go through over and over again. And that it's by listening, you will understand people. And when you understand people, you start healing them. And when you heal, that is humanity.
You were talking about role models, and I am sure that you're the role model of so many students, and not only students today. But did you have role models when back in the Philippines and then in the US, and who were they?
At that time, we don't think about role model, right? But we observe other people. My mother and my father were so very different. My father was stern, purpose driven and tough. And I grew up really being afraid of him because he was just so tough. He was a civil engineer. And as you know, they probably are just so purpose driven and exact, and you can't make mistakes. And then my mother was the opposite, very calm, very emotional. And so I think I took different values from each of them. And from my brothers and sisters, I was the ninth in the family. And I thought at that time I was often abused because I was one of the youngest. So I would have to wash the dishes for everyone. Um, and I had to wash the clothes of my older sisters and brothers. But I think those early experiences really helped me quite a bit. And I have learned to be tough and soft. I have learned to be very stern and purpose driven, and at the same time, very giving and sharing. And I think I learned a lot from both parents. I remember my father, one time I came home, I was crying and because I was beat up. I went to school 2 years ahead of schedule. So I was not only tiny, but I was so immature for everything else. And so I get beat up in school many, many times. And so when I came home crying, my father asked me why was I crying, and I said, well, I said I was beat up in school. And so my father said, I vividly remember this. He told me that he'd rather see me with a bloody face and fought rather than come home crying. And so I asked him, how can I fight? They're so much bigger than I am. So he said, I'll teach you how to fight when you're tiny. And a metaphor to that, I learned how to face adversities, even if I didn't have many resources, even if I was little, or even if I felt diminished. So I learned to stand up. I learned to keep fighting any system that I thought is not right for the common good. And I learned to voice my opinion. And then from my mother, I learned how to be soft, how to be kind hearted, and how to be giving and forgiving.
Do you think that this combination of the toughness, resilience, fighting back, never giving up, and still by your dad, and this softness, empathy, and more soft skills that you've been instilled by your mom have also had an impact on your immigration journey in the US to fight? I'd love to hear a little bit about this because coming from the Philippines, where the culture is very, very different, traditions, the everyday life, how did you embody these role models and skills when being an immigrant, and how was it for you to navigate this new land with this set of skills?
Yeah, so I came out to the US on an H1 visa. That's a working visa, and you have to keep working to maintain that visa, right? And you have to renew it year after year. So you learn how to adapt so you could keep your job, so you could keep your H1 visa. On top of that, I had a dream to go to school, and I had to think about how I could integrate working and going to school at the same time. And when I went to do my pre-med, they had a work study program. You have to be working full time, and then they could pay for your school. And I said, that's really good for me because I could not possibly pay for my school because I didn't have anyone here in the US who could help support me, didn't have any family, have to be learning everything on my own. But we had a community of nurses who we help each other. And when you go to any country, any place, you develop friends, you develop mentors, you develop camaraderie. And so I capitalized on that to help me along the way. So I think the path to success built on relationship building in learning and how to collaborate with other people, and being able to accept help from other people. So I think that disruption in many ways in my life has created a transformation in terms of how I put all of this together to make me the person I had become.
So it's more on the personal side, but going back to healthcare systems, culture, patient expectations, different cultural contexts bring different situations and eventually surprises. What was the biggest cultural shock you experienced when you first began practicing in the US?
I think in the US, because of differences in culture and differences in how we look and how we act or how we behave, I think the most that was bothersome for me is the subliminal feeling of inequity. I think that compassion and empathy are the common denominator for bridging our differences and our inequity. I think that if we care for each other, we'll all be able to assimilate well and even embrace these differences among.
And do you have some specific examples when practicing in the Philippines versus in the US that is something that is relevant sharing how different the systems are?
Certainly, there are many differences in the Philippines. I think um, uh, we care more about the relationship as it is to the exact science or metric, and in the US, metrics are so emphasized. I think, but also, well, I never really practiced medicine in the Philippines. Most of my medical life is in the US and even nursing because I left the Philippines as soon as I finished nursing school. So I really never practiced there until I came back to do these medical missions, and then now I own a nonprofit. But even then, you see the differences, right? In the Philippines, as I mentioned, we have this colonial mentality. I'll just give you an example. We were in the villages where we saw thousands of patients. There were many of us who were practitioners. Some of the providers were uh, white American. And so my line was dwindling down, and it was like 4 o'clock, and we have to finish at 4:30. So I had about four patients in front of me, whereas next to me was a physician from San Luis Obispo, who was American, and all the patients were lined up uh, on his side. And so I said, well, there are like 50 patients there, and I have four patients. So I told the person manning the trafficking, I said, why don't you move those patients to my side so we all finish at the same time? And the patients didn't want to go to my line because I'm a Filipino doctor or Filipino looking doctor. They didn't know that I practiced in the US, and they want to go to the American doctor because they felt that they will have a better care. And I was even joking. I said, that's counter discrimination. So that's an example of the colonial mentality that anything American, anything that's white is better in the Philippines, and anything that's Filipino might not be as good. But what I learned in the US is all of us can be good. All of us can share the knowledge. And what bonds us together is really our relationship with each other. And again, the compassion and the humanity.
What a striking example you mentioned about this experience of this reversed discrimination and this colonial mentality. How did you feel in that situation, given all of your achievements, strength, resilience, and success here in the US?
Well, if I ask myself when I was just building my career, that will make me feel bad, right? So I think where I am now, where I'm so comfortable of who I am and what I can contribute, I don't feel as bad. And I actually feel that that's so funny because I was thinking at that time when the people didn't want to line up in front of me. And I even whispered to my nurse next to me, I said, Well, they don't know that the one that they will be seeing here is a professor of medicine at Stanford, and the one next to me is a rural doctor in San Luis Obispo, right? So I said, well, it is what it is, but try to encourage those patients to please line up here so we could finish on time. The practicality of that is we just need to finish in time, but the philosophy is how can we train everyone that we could be all the same, that we could see each other with whatever marriage you could deliver, and that being white or being a different color doesn't really make a difference as long as you have compassion, humanity, and the willingness to help each other. And that's hard to teach. I think it comes over a period of time. I mean, even in the US, I think most of us immigrants feel a different way of being treated, right? I mean, even when you feel that the other person is trying to be equitable, you still feel that subliminal feeling that they treat you differently. And I think for people who have different color, different culture, and different races, they feel the same. But which is hard to explain because people seem to think or tell us that, well, no, I think we treat you the same. But I think as an immigrant, I think we feel it differently. I don't know. What do you think?
I hear you. It's how we're perceived by others, and this is how we perceive the situation. And because we're all coming with the awareness of disconnect or not fitting in, so we are hyper aware of our differences. And in the same time, being a European here, I'm embodying so many perceptions and sometimes misconceptions around Europeans, for example. Continuing on this, I'm teaching at one of the best schools in the world. Do you encounter immigrants who are in similar situation, who have also reached that level and still figuring out their place or how they're perceived, maybe not on a daily basis, but also dealing with this perception potential students have or other people have on them because they're immigrants, even though they achieved so much?
Yeah, many, many times. And as you know, the Bay Area is such a diverse community, and we have all different colors, different cultures, different sentiments. And I would say I encounter it many, many times that I even could identify myself when I was earlier doing the same thing. So I think I try to give them the foundation of what we could do and how we could bridge those bridges between different cultures and how to dream big, so I just keep tell them, keep going, learn how you perceive things, how others perceive you, but I think the most important thing is have your own identity and hear your own voice.
Speaking of identity, and because you have so many hats and you had such an incredible journey, how would you describe your experience in the US as a physician, educator, or global health advocate in 3 to 5 words? What would they be and why?
I would say resilience is one. um, uh, Bridge maker, and I guess change maker.
And speaking of change, you co-authored Disrupt. This is your book, advocating for change in systems that often resist it. How does disruption frame your approach to healthcare and global health innovation?
Well, yeah, thank you for talking about the Disrupt, which is a book that was published, and I think now it has 5 different iterations now. But the first one was published, I think, in about 2014, and it was a book celebrating Filipino women who broke boundaries. And to me, at that time, disruption is more than a rebellion, it's transformation. And as you know, itself is disruptive to us all. We lose loved ones, we lose our jobs, illness, changes. And so we have two choices, right? So either to resist the changes or to ride with the waves. So I've learned to ride them and to learn from their rhythm. So in medicine, I see disruption as compassion in motion, challenging systems that no longer serve patients, creating new paths where old hierarchies once stood. So my kind of disruption isn't loud. It is very compassionate disruption. It's asking, what if we led with empathy? What if care reached everyone? What if power is not an issue or power over someone is not an issue? I mean, so I think disruption starts quietly with a question, with your story, or with a student who dares to do things differently, or a student who dares to question authority.
If in the audience there is a young student from another country coming from a working class or more poor situation like you experience growing up, who dreams about coming to the US to try to achieve their dreams but feel stuck and feel that not only it may be hard to believe it's possible, but also think, how can I have a voice? What would you say to this person?
Keep going and keep pursuing your dream. If you just think about things and let barriers go between your dreams and to your destination, nothing will happen. I think you should get up and act on your dreams. Set the path, um, like I did. I think action will be the way to go rather than just thinking about it and letting barriers get in the way.
And you find solutions, right? When you're trying and take action. Going back to what you're doing in the Philippines, you're going every year, right? You still are really committed to going back there in person and also have an impact beyond these digital initiatives. So you have your mobile clinics that focus on chronic diseases and continuity of care for underserved and indigenous communities. How have you built trust and sustainability within these communities? And what has surprised you most about grassroots healthcare initiatives?
Yeah, I think what surprised me in terms of this is the difficulty really of scaling up because of funding. So that's a big surprise, and I guess that's one big barrier that we have to transcend. But I'm really passionate about globalizing education, that in integrating empathy and equity into how we train future clinicians will be the way to go. And I want to have students to see that global health is not just an elective anymore, but it is a responsibility. And I wanted to personally weave together academia and humanitarianism and to show that we could be both rigorous and be compassionate. And I think despite that barrier of scaling up the model, I think mobile clinics with telemedicine, I think, can be a bridge for the underserved, that it will provide a sustainable care for them, cheaper cost. And I think it's the way to go. I think even in the US, that will be a good model and platform to reach the underserved. I mean, here in the US, where we spend a lot of money in medical care, we are not reaching those underserved people. So I think both in the Philippines and the US, this could be a great model where empathy and compassion are brought in science and in taking care of the end users, which are our patients.
And when you talk about the responsibility, I want to highlight that as many of your roles, you know, now serve as the chair of the faculty senate at Stanford University. Can you tell us a little more about this role and how it is still deeply engage with the other aspect that truly matters to you in global health education?
Yeah, thank you for bringing that up. So at Stanford, I wore many hats as an educator, as a clinician, and as you mentioned, I was the past chair of the faculty senates. And really, those roles taught me that system and compassion must coexist. My job was to remind leadership that the most important person in every discussion about medicine is not in the room, it's the patients and our trainees. And so when I mentor students, I blend knowledge with humanity. And I tell them science gives you precision, but compassion gives you your purpose. So as sometimes as leaders, we only see bottom line, right? We don't see the very people that we need to serve, the patients and the trainees. And so I think we have to always remind ourselves that compassion is needed, challenging inequities and translating big ideas to basically a human life experience. And I think the gap in academia and the bedside will ultimately be bridged by humanity. And even with AI now, he said, AI is many people comment that AI would replace humanity. I think AI will be a tool for us to be continuously human.
And is it something that you implemented in your work, the use of AI, or do you advocate for the use of AI in a certain way, or is it something that you haven't really addressed in your work?
I think I have used AI for quite some time now, and I think AI is here to stay. I think it will be a good resource for us, but I think we could use the data as data, but we create meaning on those data, and that's what we as humans could do. We have a choice. We would not have AI replace us as humans. We still drive what AI could do. I mean, AI would provide us data in extremely efficient and rapid way. But it is us as humans to integrate the humanity, the emotion, and the meaning and the very purpose of those data. I think we could coexist. And I think AI will be a great tool for us to be more creative.
And for those who are maybe not as familiar with the academic world, can you explain what is the role that you have as a chair and what it encompasses to clarify a little bit more?
As the chair of the Senate, the previous chair now, I mean, there's a new chair. You are the facilitator. I think basically uh, my role I felt was mainly listening to the constituents. We had 60, 63 or 68 senators from many departments. And I think for me, my responsibility was to listen and to bring forth a meaningful discussion. I felt that my role was really build collaboration and build a community that everyone felt listened to and understood. And sometimes that hurt. Sometimes there are a lot of barriers, right? Because you will have adverse consequences in what you say or what you do or what your position is, and sometimes can erode relationship between leaders. But I think we should be able to communicate and we should have a meaningful dialogue so all of us will feel balanced and fulfilled in what we do.
What developments excite you next? Whether with ABCs for global health, Stanford, or global public health, or whatever other projects you have in mind. And since you always have been so passionate and involved throughout your career, what are the ones that excites you?
I think I'm excited in building this platform of globalization of education and sustainability of our medical clinic platforms and telemedicine. And I feel that, as I mentioned, global health should not be an elective anymore. It should be all of us' responsibility. And that being humanitarian should be what should be in all our hearts. And I think it is the foundation of everything that we do in medicine, in our lives, in being educators or teachers. And so I think that's what excites me is really this globalization of medicine and humanitarianism.
And Julieta, after sharing your story, when thinking about the younger version of you back in the Philippines, back to these times you had big dreams, now as an adult with this brilliant career, what advice would you give to your younger self stepping into this cross-border world?
Well, I would say, go girl, go for those dreams. Don't stop, get up when you fall, and learn from mistakes. Mistakes are opportunities for change.
Well, Julieta, that was such a wonderful discussion. Is there anything you would like to add before we end this episode?
Solon, thank you for this great opportunity to share my journey. And I hope it helps all of us to be inspired by all of our journey. And I think what you do with Beyond Borders and Bridging Cultures is phenomenal.
Well, thank you so much. And Julieta, thank you for sharing your story, your spirit, your wisdom, and global vision with us today. And your journey from clinician to change maker reminds us that medicine goes far beyond institutions. It's about people, it's about communities, it's about equity. And to our listener, thank you so much for joining us today on Beyond Borders, and stay tuned for our next inspiring discussion.
Thank you, Solon, and have a wonderful day.